Welcome back to Friends at 5. Mother's Day might be over, but we are still very much focused on National Women's Health Week, which kicked off on Sunday. Our Department of Public Health says it is a necessary reminder to encourage women and girls to make time for routine and preventative care. Joining me to talk more about this is Dr. Brannon Traxler. Thank you so much for joining me. I do want to begin by talking about diseases of the heart being the leading cause of death for women in 2022. That number is startling.
It really is, and we see it in many states in the South, and including in South Carolina. It's not just in 2022, but many years. It's if nothing else, maybe number 2. But for women, it has risen. I mean, it is higher than cancer. It is the number 1 killer, unfortunately, of women.
Do you think that women, your mom, we talked during the break, just don't have enough time?
Absolutely. How many times do we all say, I just need more hours in the day?
All the time?
Yes, but it is so important, even from a young age, really, we have to focus on ourselves at times, because we can't take care of others if we don't take care of ourselves first. So that includes making sure that our heart is working well.
Now talk to me about the unique symptoms and signs when it comes to women and heart attacks.
Sure. So women will often have what we call the more atypical symptoms. And so they may have more nausea. They may not have that classic crushing chest pain. It may be more of a subtle shortness of breath, a lightheadedness, or a dizziness. And so women need to be in tune to their bodies. And when they have these symptoms, not shake them off. They need not dismiss them. They need to get them checked out.
Not say, oh, I can wait on that.
Right.
And also this week is about not just middle-aged women or older women, but young women who can say, hey, I can also take charge of my health.
Absolutely. That's the best time to do it. That's what prevention is about. And so get 150 minutes of moderate or higher exercise each week. Eat a healthy diet. Watch your blood pressure, your blood sugar if you're diabetic. Really start those good habits early on in life.
One number that also you shared with me, 20.4, only 20.4% of women meet their recommended amount of physical activity.
Yes, and that is concerning, and that even includes all the hours that we probably do chasing after little ones. And so I think it's about being very intentional and very deliberate about carving out that time.
And I think also too, having an accountability partner. My mom helped me postpartum, and having her say, no, we're getting up and we're going to the gym makes all the difference.
Absolutely, absolutely. Having a friend that you can go out walking or jogging or biking with, that really will it'll help your mood too. And we know that women's mental health is something we also need to pay attention to.
And real quick, if I want to focus on preventative measures, if I go to my provider, what should I say? What should I talk to them about?
So you should be asking them if you're up to date on your routine screenings, including lab work, vaccinations, and cancer prevention screening, as well as things like if you have a family history for any specific condition, if you need to start screening for it earlier.
Dr. Traxler, thank you so much for your time. Hopefully someone watching this is moved to make a difference in their health. So thank you.
Thank you.
We're going to have much more to come right here on Friends at 5.